Nearsightedness causes blurry, distant vision and involves the eye becoming more oblong than round. It's a problem that most often develops in children when the eye doesn't stop growing when it should.
In nearsightedness, what happens is that signal to stop growing doesn't happen. And so it continues to grow longer and longer, and then vision is out of focus.
Allison Summers is a pediatric optometrist and associate professor at the Casey Eye Institute at OHSU. She is one of several authors of a study just published in JAMA Ophthalmology. It used a very low dose of atropine dilating eye drops in kids aged 5 to 12 for 2 years. It found the common treatment at that dose was no better than the placebo.
So that tells us that we need to keep looking. We need to find out other ways to address this growing problem.
Other ways may be a stronger dose of atropine eye drops or more advanced glasses or contact lenses. More needs to be done because the World Health Organization says myopia will increase to affect 50% of the global population by 2050. Why? There may be several reasons, but top of the list is too much screen time.
And some of those triggers are being on electronics all day. If we're staring at our phone, especially if it's very close to the face, then that can trigger some nearsighted growth.
So as a parent, what can you do to help your child? Of course, limiting screen time is important. Beyond that, experts say use the 20-20-20 rule. For every 20 minutes your child is looking up close at a screen or a book, they should look away at something at least 20 feet away for 20 seconds. That resets vision and protects the eyes. Summers also recommends getting out into the daylight.
So having an hour outdoor where you're not on a book or on a phone, but just regular playing outdoors in the daylight can be protective against nearsighted growth.
Tim Gordon, KGW News.